And so with us today, we have Tri-County Health Officer Dr. Jennifer Vines, and we have Clackamas County Health Officer Sarah Present, Dr. Sarah Present, and we have State Health Officer and Epidemiologist Dr. Dean Seidlinger, and I think Dr. Seidlinger will start. Thanks.
Good afternoon, everybody. Thank you for coming. I will update you first on some of the numbers around COVID-19 here in Oregon. We continue to have 14 cases. One of those has been confirmed by the CDC, and my thoughts go out to those individuals and their families and communities as they recover. We've had 165 negative tests in the Oregon State Public Health Lab, and there are currently 52 tests pending that we will report on tomorrow. We have 226 people under monitoring. For reference, those are folks who have potential exposure either through travel or to a confirmed case, who do not have symptoms, who are asked to stay home in quarantine for 14 days, and public health is checking on them regularly. We have had 291 folks who have completed their monitoring, meaning they've gone through a full 2 weeks without developing symptoms and have been released. Our cases are in multiple counties: Douglas, Jackson, Klamath, Marion, Umatilla, and Washington. We continue to work very closely with our federal partners and our local and tribal public health partners to best address this outbreak. We do think that even though we are reporting 14 cases, that this disease is much more widespread in our community, as many of these cases were identified as potential community transmission, meaning we can't trace it back to an individual or to a situation where they were put at risk. So that's why we continue to ask everyone to take steps to help us control the spread of this disease. Staying home when you're sick. If you have a fever or a cough illness, stay home until you're sick and recovered. Washing your hands frequently, washing down commonly touched surfaces with standard cleaning products, covering your cough and sneeze, and washing your hands afterwards. Recommending that folks who are vulnerable to complications from this disease, this is our older adults, those 60 and over, as well as those with chronic medical conditions, consider staying home and avoiding large gatherings. And that nobody with illness should be visiting relatives or friends in skilled nursing facilities. If you are sick, we would ask that you not visit at this time. We are also in the process of updating those guidelines for visiting at nursing home and may recommend more strict guidance to limit visitors at nursing homes because we know those are some of the most vulnerable populations, people with underlying medical conditions and older adults, and live in congregate settings, and we want to limit the introduction of this disease into those settings. Those guidance are being worked on now, and hopefully we will have something to release soon. We continue working, thank you to our partners at Multnomah County, on putting out guidance for the entire state on addressing this issue in the unhoused population, and adapting guidelines that were developed here in the metro area that we can distribute to our partners for working with this population who is also vulnerable and doesn't have as ready access to resources. Protection of our healthcare workers is a very important topic for us in public health. We know that they are frontline workers and we need them on the ground as this situation evolves. As we identify more cases who need to receive care, need to be hospitalized, we want to make sure that they're protected. We are in the process of adapting our current infection control and personal protective equipment guidance so we can make sure that hospitals have the most up-to-date guidance on what they can do to protect their staff and protect the patients in their facilities, while at the same time maintaining our supply of personal protective equipment and making sure that our healthcare providers are there to see the patients who need care. Testing is another topic I know you guys are very interested in. I went through the numbers of testing at the Oregon State Public Health Laboratory. We have continued to push out our guidance for our healthcare partners of priority testing at the Oregon State Public Health Lab. Providers are able to order testing and get it approved without talking to anyone in public health for folks who require inpatient hospitalization, who have viral pneumonia, and do not have influenza. In addition, our local public health partners, as well as my colleagues here at the state, are working with providers to prioritize testing for contacts of individuals who've tested positive for COVID-19 or returning travelers who develop symptoms. We know that commercial laboratory testing is becoming available, and that providers who are seeing patients in the outpatient or inpatient setting that don't meet the criteria that are being prioritized at the Oregon State Public Health Laboratory can obtain that testing through commercial means through many of the companies that offer testing nationally, including here in Oregon. Positive, negative, and equivocal test results from those testing situations will be reported to public health, as are the test results from the Oregon State Public Health Laboratory, and our public health colleagues in local and tribal health departments, along with my colleagues here at the state, will work on following those up. I'm going to turn it over to Dr. Jennifer Vines for some updates on what's happening specifically in the Tri-County area, and then we'll open it up for questions after that that we can take together.
Good afternoon, everyone. I'm Dr. Jennifer Vines. I'm the Multnomah County Health Officer, and I'm the lead health officer for the Portland Metro counties, which also include Washington and Clackamas counties. Thank you for coming to these scheduled briefings. This has really helped us balance our need to work on the response and the public's need for timely and accurate information. So I'll share with you a bit about what the counties are doing. We have a direct line to our health system partners. We continue to coordinate with them very closely. As always, we're grateful for their vigilance for this virus and their flexibility as we do our best to keep up with the science and the experience in other communities. I can say that I am not hearing of particular system strains right now in terms of capacity or staff, but that's something that we're watching closely. Local public health continues to follow up on individual confirmed cases and notify people who were exposed to ask them to self-isolate for 14 days on symptom watch. We expect more testing to come online in the days and weeks ahead, and so we expect for more cases to be confirmed. These results will be reported to public health, and this information will start to tell us truly how widespread the virus is and what the picture is. So with no vaccine and no treatment, we have two goals right now. The first is to slow the spread of the virus enough to keep our health systems running so they can offer life-saving care to those who need it when they need it. Number two is we need to protect the elderly and the medically fragile because it is increasingly clear that these individuals are at high risk of serious complications and death. And if you'll indulge me, I want to show you exactly how this looks from a public health standpoint. So if we think about a pandemic, this is number of cases, and this is time going forward. And this is what our worst case looks like, which would be a very sharp peak. And at the peak, these are all sick people, but all these people are potentially, in order to survive the virus, going to need ventilators, for example, or intensive care unit level care. What we're trying to do in public health is make this look more like this, so that we flatten the curve, so that as people in that top tier who need access to our health systems, that there is room for them, there is staff for them, and they get the life-saving care that they need. So we think, again, we're not sure because we don't know how widespread the virus is, we think we're early on this curve. And this is where things like public health follow-up can help. That's why we're doing that piece. This is why we're also going to be looking at what we're calling social distancing, which you're already hearing about in the Oregon Department of Education guidance. And I'll touch towards the end of my comments on large groups of people coming together. But this is what a pandemic can look like. This is what we're hoping to make it look like through our work in public health.
Dr. Vines, do you think you could just explain that a little bit in front of the microphone? So that people may get a clear audio?
Yeah, I don't know. Can I lift up any of these?
No, just from there you can kind of...
Oh, from here. Okay, so for those listening in, I drew a graph on a large Post-it flexi board just showing that in a sort of an unmitigated pandemic, you get a sharp peak as time goes on and cases go up. At the top of that peak would be people who would need access to life-saving care of intensive care units, ventilators, things like that. Our public health intervention is to flatten that peak and spread cases out over time so that as the most critically ill with this virus become ill, they actually have access to the care and the healthcare system staff and the resources that live in our healthcare world to have the best shot at recovering from the virus. So that's our strategy. We know that kids and young people are believed to mostly suffer mild illness. That said, just like with influenza, even young and healthy people can get seriously ill and suffer complications. It's also increasingly clear that the virus is spread through infectious droplets, meaning that you need to be within 6 feet or so of a coughing person for a prolonged period of time to be at risk. So with that in mind, we're working with schools, shelters, long-term care facilities, businesses, and detention facilities to put in place basic infection prevention measures. So what are we asking the community to do? So again, our goals are to protect older adults who are at higher risk of severe disease and keep our healthcare systems running smoothly during the time the virus moves through the community. So here's how we can all help protect older adults. If you're sick, don't visit. Check in by phone or message as substitutes for visits to see if they need anything. Help get the message out that for now, CDC is recommending that older adults avoid large gatherings. Here's how we can all protect our health systems. Stay home if you're sick and only seek urgent health care if you otherwise would. Anyone with mild illness who would not otherwise seek care does not need to be tested for COVID-19 at this time. There is no specific treatment, and our recommendation for now is to stay home until you are completely well without cough or fever for 24 hours. We know that people will still need care at clinics for cough illnesses, and we're urging clinics and patients to use telemedicine and phone appointments to the extent possible. If you need hands-on health care and you are coughing, expect to be asked to put on a mask immediately and limit the number of people with you to no more than 2 others who should be adults and they should be well. If you're sick and coming to seek health care, if you happen to have a mask at home, wear one to the site of your care. In general, for everyone, please get a flu shot. It will not protect you from COVID-19, but the flu is still circulating locally and may continue well into the spring. It's an excellent way of lowering your chances of having a cough illness and being able to continue to work and go to school. Everyone aged 6 months and older should have this year's seasonal flu vaccine, which recent CDC reports suggest is a fairly good match to circulating strains. I've heard directly from concerned parents and others about recommending school closure to prevent spread. As I said last Thursday, we do not take such recommendations lightly, and we now have clear guidance from the Oregon Department of Education and the Oregon Health Authority with the rationale that school closure may not be effective, may put older caretakers at risk, and could seriously disrupt healthcare functions related to a sudden drop in healthcare staffing for childcare reasons. I am also getting a lot of questions about large gatherings of people. So again, this is a rapidly changing situation. We are working on specific guidance around mass gatherings that we'd like to share after some input from partners and a better understanding of the implications for people's livelihoods. In general, we would emphasize what we know right now, which is that the CDC has urged older adults and those with underlying medical conditions to avoid crowds, and that anyone planning any kind of gathering should have a strong message about sick people not attending. They should have good hand washing available, and they should be prepared to politely ask someone to leave if they're obviously unwell. I think I will leave it there for now and open it up to questions.
Actually, and really quickly, if you guys, when you ask your question, if you could identify your agency or organization, and then I would just ask the speakers to repeat the question before you move on. And then so we'll take questions from the room first, and then we'll open it up to the phone, people on the phone. Thank you.
Lindsay with KGW. I think there was some confusion about older adults. Is that anyone over 60, even if they don't have an underlying medical condition?
What the data is showing, and we have the most data from China, but data from other countries is showing the same thing, is that older individuals, regardless of their health status, seem to be more at risk for complications. So the cutoff for older adults for the CDC recommendations are 60 or older, and then children or adults, regardless of their age, who have underlying conditions such as respiratory illness, cardiac disease, diabetes, hypertension, obesity, other immunosuppression, other items that would put them at higher risk would also be considered vulnerable.
And can you confirm the number of people who are being monitored? Was it 126 or?
We have 226 people currently under monitoring, with 291 who've completed their monitoring as of this morning.
Brad Schmidt with York. I mean, how many tests do you still have remaining?
I don't have the answer for how many tests we have on hand, but we anticipate receiving additional supplies in the next couple of days.
Who can answer that question? That's a question that's been posed multiple times. Does the OHA not know how many tests it has remaining?
The tests remaining depend on what's used in that day, how many are done at a specific time, so it's not a one-for-one that they're used. If we batch more tests, the tests go further. If we test smaller batches of tests at a time, they don't go as far, so we can try and get you that answer.
Fedor with the Oregonian. So how long does the coronavirus stay on services in a way where someone can still get infected?
The best evidence we have from that is really from other coronaviruses. It still seems to be in the range of several hours, so in the 1 to 3 hour range. Some coronaviruses have been reported to survive up to 9 hours. We haven't seen specific evidence of that with this coronavirus, but the good news is that routine cleansing of environmental surfaces does kill this virus, and that's why the recommendation also for routine hand washing and not touching your face is so important, because even if the virus is on a surface and you touch that surface, if you wash your hands before you touch your face, you're not going to become infected with that virus.
What is the condition of the first patient that was confirmed with COVID-19?
I don't have any updates other than that they're still hospitalized.
Dr. Seidling, Lisa from COIN, just as a follow-up to that comment you made about the surfaces, there's a lot of concern among the public that they're not being told where these patients have been. And so if it is something that is more than just somebody coughs or sneezes within 6 feet of you when you're there, but it is on surfaces and can last for anywhere for a few to several hours, again, why not let people know where these folks have been?
I think that in addition to these 14 cases, there are likely many other cases in the state of Oregon that we haven't identified. Many of these cases are thought to be from community spread. Public health has done a great job interviewing them, seeing who they had contact with before they were sick, whether they traveled before they were sick, and we can't link it to a specific case or to specific travel. So that means they obtained it somewhere in the community. So even if we knew exactly where these 14 people went, there are many other people who've been out in the community, and that's why this virus doesn't spread in the air. So just being in an environment where it was there doesn't mean you're going to get sick. If you touch a surface that has the virus on it and touch your face soon thereafter without washing your hands, that's what puts you at risk. So that's why all individuals with good hand washing, covering their coughs, and not touching their face, that's something that all individuals can take to protect them. And then folks who have a facility doing routine cleaning can get rid of this virus from the surfaces to limit its spread.
Fedor with the Oregonian. So to make sure we understand what you're saying, does that mean that essentially the virus is so widespread that telling people where they may have been exposed would make a substantial impact on containing the spread?
For the folks who have been tested for the disease and found to be positive, we have gone back and done contact investigations, our local and tribal public health partners, with those they had contact with, because it's contact within 6 feet of that person who's coughing or sneezing that's going to put someone at risk. And so those are the people we've identified and worked with to have them quarantine at home. And if they develop symptoms, those are folks who get tested to determine whether or not they have COVID-19 or another source for their febrile illness.
But wouldn't notification maybe make it easier if somebody sees that and says, hey, I was in there, I'm having cold symptoms, maybe I'm the person that spread it, and maybe they don't know?
No, because again, this virus is spread not through the air but through droplets. And so that person who is sick, who is coughing or sneezing, and someone who is within 6 feet of them is the person who's at risk. And so that's why we are working with the individuals to identify who is at greatest risk. And just these 14 people are the folks who've tested positive, but we know there are other cases out there. And so that's why everyone needs to take the precautions, not just if you're in a specific location, to wash your hands, cover your cough and sneeze, and stay home when you're sick, because that's really what we're going to do to help control this disease.
But if you can't contact people, say you sneeze at someone and the bus, and that person doesn't know you can't find that contact, but the person knows that they've been in that place, wouldn't that make it easier to contact
Like,
other
what's the
people?
downside of doing that?
Because, again, we know that this takes prolonged close contact and contact to the droplet precautions, and so that's why our public health system is doing the job that it does every day with other diseases as well. We don't notify someone who's been on the bus with someone who has influenza because we know that influenza is out in our community, and that's why we ask that everyone take some responsibility for their own health and protecting their family's health. And we've worked with our partners, for example, in transportation, in public buildings, and schools to clean surfaces to limit the virus that's on those surfaces.
Let's take a few questions from the phone. Operator, can you see if there are any questions?
And ladies and gentlemen, if you wish to ask a question at this time from the phone lines, please do press 1, then 0. And once again, do press 1, then 0 at this time for any questions from the phone lines. And speakers, currently we have no one from the phone lines that are queuing up, so please do continue.
Thank you, Albert.
Well,
I just want to go
I was
back.
just
Dr.
going
Vines would like
to
to-
tag on to this idea of why aren't we telling where the people, like, where the virus might be? So that's part of the local public health investigation in terms of where that person spent time. That is very resource intensive in terms of their timeline. We're much more cautious for a disease like measles that we know is spread through the airborne route. It can hang around in the air. That's why you see occasionally some public notification around exposure sites for measles. In this case, we are concentrating public health resources on those that we think are highest risk. So that's generally household level contact or close social contacts. A bus ride, being in a hospital waiting room that we know is being cleaned regularly. Those types of exposures we would generally not consider high risk. So again, we think this virus is in our community. It can live on surfaces. Our emphasis is more around take everyday precautions rather than trying to limit people's focus to just where we think the virus might be. Because from a public health standpoint, the same advice still applies. Stay home if you're sick, wash your hands, and we're really focusing those local public health resources on the highest risk.
I had some questions, Lachey with K2 News, about the incident at the middle school. With that one student being tested positive for the coronavirus, at what point was that student contagious? And do we know for how long?
So we don't have our Washington County Health Officer here today. She's busy working on the COVID response, so I don't have details, and I wouldn't want to give you bad information, but we can get you that.
Going back to the issue of testing supplies, there have been 14 positive, 165 negative. I just want to be clear, each test requires at least each person requires at least 2 tests, correct?
We have currently been performing 2 tests on most individuals. Some individuals have more.
Okay.
And the number of tests used, because we have to run controls on each batch that we use, there are additional tests that are used for that those quality assurance activities.
Okay, perfect. So that means then that you've used at least 358 tests on those 2 sets of people. Then you have 52 pending tests, which means that that's going to require 104. That means you've used at least 462 total tests out of your 1,500. If you have 52 total tests pending, or people pending, at 100 per day, and then 104 per day, you're going to run out of tests within 10 days.
Right, which is why I said we've ordered additional reagents to perform these tests, and those reagents are on their way. We continue to prioritize the tests for those who are most seriously ill in our Oregon State Public Health Laboratory, as well as those who are contacted as part of our public health investigations. And we anticipate we have sufficient supplies to meet that need, with commercial testing becoming more widely available in the community. For those doctors and providers who think clinically that the person in front of them needs to be tested, they can test those without any contact with public health. But we still think that most people with mild illness do not need to seek care and do not need to be tested. But those would not show up in the public health laboratory here in Oregon.
How many tests have you specifically requested?
I don't have the answer to that.
Just to be clear then, so OHA asked for these tests last week, and 4 days after this request, or after Lillian and Shirley testified in front of the legislature that more tests would be requested, no one at OHA can explain how many tests they've requested?
I cannot explain how many tests have been requested, and I said I would get you that answer.
When do you expect to get those tests?
I told you, I anticipate those tests are coming in the next few days, is what the email said, but that's determined by our federal partners when they're delivered.
Are you concerned that they won't arrive within the next few days? And the reason I asked that is because you guys said that the CDC would be confirming tests within the next few days. It's been more than a week on some of these cases, and they've yet to do it. So what level of confidence do you have that these tests will actually arrive?
I have a high level of confidence these tests will arrive.
How does the testing work? Is it similar to the flu? Like, how do they do it? And is there something special about that little vial if you need that? Like, if I'm a doctor, I have a patient I want to test, can I take the test and the state lab just won't be able to process it? Or do I have to order these vials that we've seen pictures of and need those to be able to even do that?
So the tests are collected either typically from nasopharyngeal or pharyngeal, a swab from the nose or from the back of the throat that are collected. They're placed in viral culture media, so that keeps the virus alive. The test extracts the viral genetic material from those tests and looks for the specific genetic sequence of this virus with the reagents, with the test kits they get from the CDC. So it uses some common lab equipment that is available in the lab, but needs the specific equipment to look for this sequence of genetic material.
Lily and Shirley last week said that another hospital or a hospital system was looking to either develop lab capacity or testing capacity. It was unclear in her comments to the legislature. Can you please address what it is that a hospital system is looking to do here in Oregon and what the timeline is for either the lab results or testing to be available?
And I don't have information on the timing for specific hospital systems here in Oregon. I do know that 2 of the largest commercial lab testing facilities have gone online at the end of last week and the beginning of this week that do serve parts of Oregon providers. But I don't know about specific lab testing in hospitals.
So, sorry, just to clarify. So if I'm a doctor, I have a patient I want to test, what would I have to do? Would I have to order the test from a private lab to be able to do that, or can they send it?
If there's a hospitalized patient in Oregon with viral pneumonia who doesn't have the flu, providers can go online, fill out the order form, and make arrangements to have that test shipped to the Oregon State Public Health Laboratory for testing. If they're concerned about a contact to a specific case or association with travel, they can contact their local public health authorities who will talk about whether that test will be tested at the Oregon State Public Health Lab. For outpatients who are not being hospitalized, not connected to a known case, they can order that test from their lab provider in the way they'd order any other test. They'd need to collect that specimen and get it to the lab for testing.
How many people have had their lab results refused to be tested or not allowed to be tested by the state lab because they didn't qualify? Presumably doctors are asking, hey, I've got this patient, I'd like to get them tested, and somebody along the chain is saying, sorry, you don't qualify. So what's that number?
We don't track that number.
OHA doesn't track it at all?
No, we have tracking of the tests that are requested and the tests that come in through local public health authority and on those testing, and that's why we've provided those numbers to you.
All right, let's try the phone one more time. Operator, go ahead and open up the line. Thank you.
Now, and once again, as a reminder, any questions, please do press 1, then 0 at this time. 1, then 0. And speaker, there's no one in queue at this time. Please do continue.
Thank you.
So Dean and Jennifer, so at this point, have you modeled how many people might get sick, might die, might need ventilators based on what you know, what you've seen so far in this?
So the question was based on some of the graphics I drew about how to spread out disease and mitigate a potential pandemic. The question is, have we done some actual calculations of how many people might need care, might need ventilators, and what that might look like? I would say our focus right now has been around tracking cases, confirming cases, looking for contacts. I think we're going to be shifting our attention more to, again, protecting high-risk populations, protecting health systems. So looking ahead at the next step, I think, would be starting to think through those scenarios and what that could look like, and again, how we can get people the care they need when they need it.
So right now, the Tri-County area and OHA don't have, say, like worst case scenario number, best case, like any numbers that would say worst case scenario, we think X number of people will die.
No, so I don't have those numbers like at my fingertips to quote you. It depends. Again, we're getting more information all the time from other countries about how many people are critically ill, how many die, and what that actually looks like. But I think this is going to be part of our next step in responding. And I don't know if Oregon Health Authority has actually run those numbers.
Is that a no?
No.
I just have a question. With other schools and other states closing schools, what's the Oregon Health Authorities, at what point, what's the threshold to close a school?
I think, we have those discussions. If there's ever a case associated with the school, public health and the school will have a conversation about what next steps are. The benefit from closing a school to minimizing spread of the disease is probably fairly minimal, but the negative impact on students and faculty at that school are larger. So we have those discussions each time a case comes up, but the thought right now is that it's better to have kids in school and learning and exclude those who are sick and monitor them at home than to do a blanket school closure statement at this time. And our guidance is in line with a lot of other jurisdictions who have very similar guidance posted from cities and states to other countries.
At the beginning you said 14 cases, one confirmed by the CDC. Does that mean the rest have not been confirmed, or?
Correct. That's why we still call the others presumptive positive, but we treat those as positives because the same test is going to be done by the CDC on those cases, and we wouldn't anticipate any difference in the testing results.
How long does it take to get that confirmation?
I don't know.
Do you receive any explanation about why it's taking so long?
No, but I can only assume that our federal public health partners are receiving, not just samples from Oregon, but from all other state and local public health labs that are doing this testing, and they have to do that confirmatory testing on all of those. Plus, they're receiving samples directly from the states that don't have public health lab testing capability in their states and are doing some of the testing in special situations themselves without using the state. So that's probably why we haven't received those results yet.
Do one more question, or two more questions. How many ventilators does Oregon have?
I don't have that information, but I can get it for you.
I was hoping, I know you can't talk about specific instances, but possibly in other countries that people are dealing with this virus. When they're in the hospital, can you kind of explain once they are having complications from it, what kind of they're going through, what kind of strain there might be on a hospital or et cetera?
So with COVID-19, similar to influenza viruses, it primarily affects the respiratory system. So people with mild illness may have a cough and some trouble breathing. The complications that we're seeing people develop typically start with respiratory problems and respiratory failure. But once patients have those symptoms, they may have other organ systems that are also involved. So they may need support around their kind of renal function, cardiac function, and others, but it typically starts with respiratory failure and trouble breathing.
Given that we know that there are very likely more cases out there in the community that are not being diagnosed because of a lack of testing, are there other diseases or medical conditions that could potentially serve as a proxy for people who are getting sick with mild forms of this illness? Specifically, it looked like at the end of February there was an increase in the presentation of influenza-like illness into emergency rooms, which did not seem to jive with previous years of having it go down and then go back up. Viral pneumonia, is that something you're tracking? What can you tell us about potential proxy cases out there that suggest this is in fact widespread?
So, we do track influenza-like illness and then influenza surveillance with testing at various sites every year. This year's influenza season was a little different than others, which typically have a single peak. This really had two peaks, with a peak of influenza B early in the season. Influenza B is a strain of influenza that typically comes near the end of the season, though there's really no typical flu season. And influenza B also disproportionately affects children. So tragically this year in the United States, we saw a record number of pediatric influenza deaths. That peak in influenza came early and then with a second peak following. And we're still seeing circulating influenza in the community, but not at the high levels we saw earlier in the season.
But specifically to COVID, because you would test and you would confirm, okay, this is in fact an influenza. So what I'm saying is, are you seeing influenza-like symptoms, illnesses that are not confirmed to be influenza, or viral pneumonia cases? Have you seen a rise in those presenting across the state in the past 2 weeks?
No, we monitor influenza-like illness in emergency department settings and other settings, and we continue to see that disease is maintained in our community, but we haven't seen large spikes in influenza-like illness or specifically in influenza over the last 2
Or
weeks.
pneumonia?
I can't speak specifically for
Are you
pneumonia.
guys tracking that?
We do track respiratory complaints and respiratory illness in our systems, yes.
Okay, so that's something you guys can get back to us on?
We can. The pneumonia issue will be a little different than the influenza-like illness tracking, which is based on symptoms, whereas pneumonia is based on an actual diagnosis. So it would have to be, it wouldn't necessarily be pneumonia, but signs of lower respiratory infection would be the earlier signs.
I don't think we track pneumonia specifically.
And I would just add, again, as of today, I'm not hearing of particular strains on healthcare systems. I think there's the artifact of a public health situation going on, where we're through, with your help, we're getting messages out. There may be some artifact in there of people who are worried and who are hearing the messages that you're helping us get out, and who may be presenting to healthcare who might not otherwise. So just a caveat in terms of how we look at what's going on in the community.
Okay, thanks, everyone.
Yes.
So